Hello everyone, this is Kiran, one of the Menlo Park bloggers. Here today to talk about the second topic that I thought would be quite helpful for GPs and GP registrars. I'm going to tell a story of a patient who had a very uncertain diagnosis, and fortunately the diagnosis was reached and she got better. But I want to use it to illustrate two key points. The first of which is that 80% of the diagnoses are in the history, and taking a good, thorough, solid history is the bedrock of medicine. And the other 20% is using the tools we have, that being clinical examinations, blood tests, radiological evidence to confirm or rule out various possibilities. The second point I want to stress with this case is the fact that the GP is centre to the patient's journey and their care. We are fortunate enough in this country to have, I would say, the best healthcare system in the world. And part of the reason for that is that there is an advocate for the patient at the centre of everything that's done, that being the GP. So the story in question is of a middle-aged lady who, on the on-call list for the GP surgery, presented with fatigue and bloating. Spoke to her over the phone, asked her to come in for a clinical examination. Her bloods, which had been done a couple of days prior, showed an albumin of a very low albumin of around 9. So when she came in, she was incredibly edematous, did a urine dip, showed protein, diagnosed likely nephrotic syndrome, sent to the medics for a nephrology workup. However, she came back a couple of weeks later looking pretty much the same, having had no particular answer as to why she'd become that way, and not with huge amount of clinical improvement. So I referred her then back to renal and had a discussion with renal about what the likely diagnosis was. Her urine protein, creatinine ratio was actually okay, suggesting a nephrotic syndrome or renal cause was perhaps not what was going on. So then I had to consider gastrointestinal causes of low albumin. So I referred her to a gastroenterologist to consider whether it was a nutritional problem or absorption problem. Gastroenterologist did a scope. They showed some duodenitis, but not sufficient to explain what was going on. So then I was stumped at this point, and I knew this patient wasn't getting any better and that she was high risk of cardiac failure or embolism. So I went back and just did the history again really thoroughly without trying to make any assumptions. And over this time, fortunately, because I've been in the centre of her journey, because I built up a rapport with her, and because I just focused on the history, eventually on the drug history, I asked about any over-the-counter medications, and she disclosed to me that she'd been sadly addicted to Nurofen Plus. That's ibuprofen with a low dose of codeine in it. However, she'd been taking an excessive quantity of this, up to 30 tablets a day, which I then realised must have been causing a protein-losing enteropathy, which was causing her to lose all her protein was being absorbed into her gut, which was then causing the fluid. And finally, we had an answer. Switched her onto an equivalent dose of codeine, which then meant that she wasn't having the NSAID, and she gradually improved. So what's the point of the story? I'm going to bring back to those 2 points. The first one is the diagnosis was in the history all along. That was not new information. That was information that the patient knew the whole time, but didn't understand the relevance herself, or perhaps was a bit embarrassed to share it. But a good history was what gave us the diagnosis in the end. And the second point is the GP has that fortunate role of being able to see the wood from the trees, being able to coordinate a patient's journey and benefit from super specialist knowledge from a renal team, a gastro team, but being able to see the bigger picture as well. Obviously not knowing as much about those individual specialties as the experts. So I hope this was useful. It's an interesting case, but I do think they are 2 points, not only that are useful for medicine in general, but pertain specifically to us as GPs. And that's something that I hope we can continue to hold as our bread and butter, and the thing that makes us unique as practitioners. Thank you very much. I hope you all have a wonderful day.